Welcome to the abdominal curl with extra arm float if you want to as we progress. You'll find that we're in our base position, supine, so make sure that we set up everything correctly before we begin. Core engaged, spine lengthened, neutral spine, lateral thoracic breathing. Keep your shoulder stability. Let's start with a basic abdominal curl. So we breathe in to prepare. And as we breathe out, we're going to start to lengthen the spine, curling through the upper body. And then release on the breath in. So breathing out, we curl up, nice and smooth. Breathing in as we release and roll it back down. Now we're working our spine one chink at a time. So remember, the spine comes into the middle of the head. We lead with the top vertebrae and start peeling up one chink at a time and then melting back down into the floor one bone at a time on the way down. Now we're not actually wanting our belly to pop up, so if you need to place your hand on your stomach, when you curl up, make sure there's no doming, no popping of the belly. You need this nice flat area to remain stable. And your aim is to pull your chest bone towards your belly button. We're shortening the front, lengthening the back. Keep it a nice steady rhythm, just work to the pace of your breathing. And check the position of your head. Now we should be able to fit a tennis ball or an apple under our chin at all times. It helps if you keep the eyes looking up to the roof, because we don't want to be pulling with the chin. We're not flopping our head. And if you feel that you're getting a bit of neck strain, then that probably means you're trying to pull and lift with the head rather than using your abdominal muscles. So we are using the abs, we're shortening the abs, lengthening the spine. Pull your chest bone to your belly button as you breathe out. Breath in, release. And you work as many of those as you can do perfectly. Obviously take a rest if it gets too much before you try more. We're going to progress now. If you need an extra layer of difficulty, challenge those abs a bit more, then we do exactly the same to begin with. Breath in, prepare. Breathe out. Do the abdominal curl, chest bone to belly button, gap under the chin. We're now going to hold it here instead of lowering. And as we breathe in, we're going to float our arms. Breathe out, release the arms. Breathe in, and that is when we lower the body down. So we're actually holding the curl for an extra breath at the top whilst we add the arm action. Now the float action tries to stretch the abs whilst you try to keep them crunched. So it gives that extra challenge. Just float the arms as far as you feel comfortable, because we don't want our rib cage to lift. We want our chest bone to stay pulled down towards the belly button. And we want to make sure our shoulders stay in that stable position. So no hunching of the shoulders, no closing of the gap under the chin. Work into the pace of the breath. You'll find you can get a nice smooth rhythm going. And it's not all about making the big actions. It's about the precise movement, the control of the movement. We're shortening the front, keeping it short as we challenge with the arms. We lengthen the back, keeping the spine stretched all the time, our core engaged all the time. And just think about your neutral spine as well. So there should be no pressure change anytime under your lower back. We are always in the neutral position. So if you feel that you're getting a pressing into the floor, then you've imprinted. We're not supposed to be pressing down, and we don't want the belly popping up either. So keep that neutral position. Really use your core and focus on the muscles we're working, which is those abdominals. We've got our deep core working inside, and we're now working the abdominals on top. Do as many as you feel need to. Perfect technique, good control. Take a rest at any time you need to. Possibly aiming to do a maximum of about 10 to 12. But then when you finish, just take a nice long stretch out. And that will loosen the tension that you've created in those abdominal muscles.